Why do your feet hurt so much? People say that walking is one of the easiest, most effective, and easiest to get forms of exercise. This is true, as long as you don't have foot pain that makes every step hurt. According to the American Podiatric Medical Society, 77% of U.S. adults have had foot difficulties, which suggests that going for a walk may be more appealing than sitting on the couch for the vast majority of us. Since the foot has nearly as many bones as the hand and wrist, it's a complex piece of real estate. This may be especially true for women, owing to the fact that many women wear shoes that are too small for their feet. The end result? Bunions, hammertoes, and other painful foot abnormalities can all take the spring out of your step. So, what's a walker to do, especially if you're a self-confessed high heel fan? Understanding why you have persistent foot pain is the first step toward resolving it. Here are the most prevalent issues that may prevent you from pounding the pavement, as well as what you can do to get your feet happy again. This is by far the most common condition I see in my middle-aged patients. Plantar fasciitis is a painful overuse syndrome that affects the band of fibrous tissue that runs around the bottom of your foot, called the plantar fascia. You don't see plantar fasciitis in children because they heal so quickly. And you don't see it in the elderly because they aren't involved in things that might contribute to it. But if you're between the ages of 40 and 65, you're more likely to suffer from heel discomfort, especially if you're overweight. The impact on your feet is approximately 120% of your body weight. This makes the tissues in the foot less flexible over time, which can cause pain. Massage and stretch your feet and calves for relief. A good massage can help reduce inflammation by sending fresh, oxygenated blood to the area. It can also lengthen the plantar flexor muscles, making them easier to move and less painful. People tend to focus simply on the bottom of the foot, forgetting that the plantar fascia is part of a system that begins with the calf muscles and extends all the way to the Achilles tendon. While changing your shoes or trying different insoles will not heal your plantar fasciitis, it will certainly make things more comfortable. Try these alternatives, which are all recommended by podiatrists and have enough arch support, a solid but flexible midsole, and cushioning for the front of the foot. Best walking shoes. New Balance 1540V3, New Balance 1540V3, New Balance 1540V3. Perfect Slip-On Sneakers. Connie Perforated Slip-On Sneaker by Vionic. Connie Perforated Slip-On Sneaker by Vionic. Optimum Running Shoes. Levitate 4 by Brooks. Levitate 4 by Brooks. The Best Slippers. Indulge in Vionic's Women's Gemma Slipper. Indulge in the Gemma Slipper from Vionic for ladies. Foot pain from bunions. Bunions cause a solid, painful lump to form at the base of the big toe, forcing it to veer diagonally toward the second toe. Bunions might worsen if you wear too tight shoes all the time. These joints usually become painful when shoes rub on them, causing inflammation, swelling, and redness. Fix your feet by wearing proper shoes. Wear shoes with a wider toe box to help prevent bunions from forming in the first place. The distance between the tip of your longest toe and the end of the shoe should be around a ½ inch. You may also add cushioning to your shoes to help relieve calluses, which are created when these swollen toe joints scrape against your shoes, or consult your doctor about adding orthotics to your shoes. These implants may improve the biomechanics of the foot, helping to keep muscles and tendons in balance and stopping bunions and hammertoes from getting worse. Hammertoes. A hammertoe is a foot malformation in which the middle joint of your toe bends abnormally. Hammertoes occur as a result of a muscle imbalance in your foot. Your feet have muscles at the top and bottom. A hammertoe might develop if one of those muscle groups is stronger than the other. Explains the toe becomes crooked when one of the toe muscles weakens, putting pressure on the tendons and joints of one or more toes. As a result, the toe sticks up at the joint. Hammertoes. Some of the most common reasons for hammertoe are wearing poorly made shoes that don't fit your feet, getting an injury like stubbing your toe, or having a history of hammertoe in your family. Individuals who have hammertoe are more likely to develop corns and calluses. Corn pads are helpful because they give support and cushioning, relieve pain, and keep skin from rubbing together. In this scenario, medicated cotton pads should be avoided, because the acid in the drug might eat away at your skin and allow germs to grow, leading to an infection. Wear shoes that are right for the exercise and made for it. Avoid wearing the same type of shoe all day. Wear your commuting shoes to work, but avoid wearing high heels all day. It takes 15 minutes, you're sedated, and it's covered by insurance. Flat feet. Flat feet happen when the foot has no arch at all, so when you stand, your whole foot touches the floor. This is more frequent than you might think. Over 18 million Americans suffer from the unpleasant ailment. Flat feet are common from birth, but they can also develop later in life if the posterior tibial tendon, which connects your calf muscles to the bones on the inside of your foot, is injured. If you do a lot of high-intensity sports or activities, the posterior tibial tendon can get overworked and irritated. As a result of this, you can have flat feet and are more likely to suffer from plantar fasciitis and bunions. Put on orthotics. The best thing you can do is wear suitable shoes and orthotics, which force your foot to walk with an arch. Orthotics will also help absorb shock while walking or jogging and stop pain in the ankles, knees, and back, all of which are caused by flat feet. Calluses. Most people think that calluses are just ugly, but they are actually pressure points that can make walking painful. Surprisingly, they are the body's technique for avoiding painful blisters from forming. Without a callus, the pressure and friction would irritate your skin to the point of forming blisters, which are painful, fluid-filled bubbles. It won't help if your calluses on the ball of your foot, the heel, or the top of bunions or hammer toes prevent you from walking or jogging comfortably. Soak and soften your feet. To treat calluses at home, soak your feet in warm water and then put on a moisturizer with glycolic acid, lactic acid, or urea. These substances can help soften the skin and reduce callus formation. If your callus is exceptionally large or severe, make an appointment with a podiatrist or dermatologist who can remove it with a surgical blade or offer a cortisone shot if the agony is excruciating. Toes on the turf. According to the American Academy of Orthopedic Surgeons, turf toe is a sprain of the big toe's primary joint. This can happen when the toe is forcefully twisted up, such as when you're sprinting and your toe gets trapped on the ground. It can happen to any toe, but it commonly happens to the big one when you are trying to push off the big toe and another force, such as a person rushing into you, a car accident, or riding a horse, pushes you down. The ligaments around the joint stretch and sometimes tear as a result. It's excruciatingly painful. The name, turf toe, was given to the injury by the American Academy of Orthopedic Surgeons, AAOS, because it became more common in football players after artificial grass became popular on playing fields. Artificial turf is a tougher surface than grass and has less give than other pitches. A turf toe can cause pain, edema, and stiffness at the big toe's base. Something takes time to grow and progress. Rest, freeze, compress, and elevate your toes. It's an acronym called RICE. You want to ensure that your ailment receives the rest it needs, which can help protect it from additional injury. Icing and compressing the injuries, any wrap will do, will help reduce swelling and pain, he says. Finally, elevate your foot, say, on top of a cushion, to relieve pressure. Because your feet absorb pressure that you aren't even aware of, you need to pay special attention to avoid further harming yourself. Tendinitis of the Achilles tendon. When you misuse your Achilles tendon, which connects to your heel bone at the rear of your foot, it can become irritated and inflamed. Tendinitis occurs as a result, and runners as well as individuals who routinely wear high heels are particularly vulnerable, according to her. Inflammatory diseases like rheumatoid arthritis or gout could also be causes, even though they are less common. Relax, ice, and repeat. The sooner you address this issue, the less discomfort you will have for a week to a month. If you feel even a slight twinge, ice the affected region right away. Your doctor may also tell you to take a non-steroidal anti-inflammatory drug, like Motrin or Advil, to relieve pain and reduce swelling. Metatarsalgia. This is a common foot condition affecting the bones and joints in the ball of the foot. Most metatarsal problems occur when something changes in the way your foot works normally, affecting how your weight is distributed. This might put additional strain on the ball of our foot, resulting in inflammation and pain. There is a single potential cause of metatarsalgia, but more frequently than not, there are several, such as extensive training. Runners are at risk for metatarsalgia because the front of your foot absorbs a lot of stress when you run. This is a common problem for people who do high-impact activities, especially if their shoes don't fit well or are worn out. Get new shoes, investigate orthotics, and rest. Your doctor will most likely order an X-ray to ensure that your bones and joints are in good condition and that you are not suffering from a stress fracture. If your shoes are worn out, it is best to replace them. Metatarsalgia is best treated with footwear that has a high, wide toe box and a rocker sole. The toe box is high and wide, allowing the foot to extend out, and the rocker sole relieves stress on the ball of the foot. Orthotics that take away pain from the ball of your foot can also help. Tarsal tunnel syndrome. Tarsal tunnel syndrome is similar to carpal tunnel syndrome. However, it occurs in your foot. Similar to carpal tunnel syndrome, mechanical forces, pinching, the nerve are what cause it. An ankle injury or flat feet are the usual causes of this, which can cause pain, numbness, and tingling. Because of the pressure and tension that falling arches put on the nerve, people with flat feet are more likely to develop tarsal tunnel syndrome. Rice is a wonderful option, and anti-inflammatory medicines can help reduce inflammation. Physical therapy may also help relieve your pain, and orthotics that support your foot's arch and relieve stress on your tibial nerve don't harm either. Morton's neuroma is a type of neuroma. This condition is said to cause pain in the ball of the foot that usually spreads to the third and fourth toes. It can seem like you're walking on a pebble caught in your shoe. Women who wear high heels or narrow, sharp shoes frequently develop Morton's neuroma. When you wear tight shoes, your metatarsals, which are the bones in your foot, are squeezed. They press against the nerves surrounding them, generating a severe, stabbing pain. High-impact sports like tennis and running can also result in Morton's neuroma. The constant hammering on hard surfaces might cause nerve damage to your toes. Morton's neuroma is more common in people who have bunions, hammer toes, high arches, or flat feet. New shoes, special orthotics, and possibly cortisone injections are all options. Massage the gap between the metatarsals to provide immediate relief. Use your thumbs to massage the top of your foot and your other fingers to apply pressure to the bottom. Massage the nerves in the crevices between your toes. Schedule an X-ray with your doctor to rule out other problems. Then, follow up with an ultrasound or MRI, which are better ways to find problems in soft tissues. You could try arch supports, foot pads, or custom orthotics to help curve and cushion your foot when walking. Wearing a variety of shoes and discarding those with worn soles. If these more conservative measures fail, cortisone injections or even surgery to relieve nerve compression may be options. 11. Arthritis occurs when the cartilage in your joints deteriorates and causes inflammation. Arthritis signs and symptoms. Past traumas and injuries like broken bones and sprains frequently contribute to the development of arthritis. However, age is one of the biggest causes because cartilage wears down with age. Painful and tender joints, stiff and swollen joints, and trouble walking or bearing weight are all common symptoms. Use anti-inflammatory medications, wear orthotics, and get physical therapy. Depending on where the disease is and how bad it is, there are many different ways to treat arthritis. Anti-inflammatory or pain-relieving drugs, both oral and topical, as well as steroid injections. Orthotics are made to order. An ankle-foot orthosis brace is a form of brace used in physical therapy. Keeping a healthy weight. If your arthritis does not improve with more conservative therapies, follow us at www.newstoday.nyc online and News Today reviews. Why do your feet hurt so much? If your arthritis does not improve with more conservative therapies, follow us at www.newstoday.nyc online and News Today reviews.